Hello, my name is Maggie Chung and I will be presenting type 1 diabetes and CAM usage today. My classmate Shavina Fife did the research on this topic. First, I'll be talking about the epidemiology of type 1 diabetes, including the condition defined, signs and symptoms, prevalence, and the etiology of the disease. Type 1 diabetes is a chronic autoimmune disease where the pancreas produces little to no insulin. Insulin is a hormone that is needed to convert carbohydrates from our food into glucose for energy to be used in our body. Without any insulin, this leads to a high level of glucose accumulating in the blood. The first signs and symptoms of type 1 diabetes include increased thirst, feeling hungry, fatigue, blurry vision, numbness or tingling in the feet, weight loss, and frequent urination. To the right shows how symptoms of diabetes affects various parts of the body. The symptoms marked in blue are more commonly seen in type 1 diabetes. Diabetes increases a person's risk for many health problems. It is important to maintain normal blood glucose levels to prevent or delay the onset of these complications. Poorly managed or uncontrolled diabetes can lead to some serious complications including skin infections, eye complications like glaucoma and cataracts, nerve damage, ketoacidosis where the blood becomes very acidic, kidney disease, high blood pressure, and stroke. These complications may eventually all lead to death. Type 1 diabetes is quite prevalent in the United States. About 1.25 million American children and adults have this disease. Non-Hispanic white children, adolescents have the highest rate of new cases of type 1 diabetes compared to other groups. During 2008 and 2009, about 18,436 people younger than 20 years in the United States were newly diagnosed with this disease annually. Type 1 diabetes can occur at any age, but is usually diagnosed in the mid-teen years. The exact cause of type 1 diabetes is unknown. It is considered an autoimmune disease where the immune system mistakenly attacks insulin-producing beta cells in the pancreas. This leads to reduced or no production of insulin to lower blood glucose levels. This disease tends to run in families. The HLA genes show that there's a genetic component to this disease. Also, exposure to viruses in the environment may also trigger this disease. Now I'll be talking about the pathophysiology of type 1 diabetes. Genetics and environmental factors trigger CD4 plus and CD8 plus T cells and macrophages to attack and destroy insulin-producing beta cells of the pancreas. As beta cells decrease, insulin secretion decreases until it can no longer regulate blood glucose levels. The excess glucose circulates in the blood, which leads to hyperglycemia. This causes glucose deprivation in tissues and cells, which triggers the breakdown of fats and proteins to be used as energy instead of glucose. Glucose is the body's main source of energy. In this picture, you will see how glucose and insulin play a role in our body. Glucose enters the bloodstream from the digestive system and liver. Because there is no insulin available to bind to the cell, glucose cannot enter the cell. Therefore, the cell has no glucose to be used for energy, so then the glucose returns to the bloodstream. Diabetes occurs when there's an unhealthy amount of glucose circulating in the bloodstream, which leads to hyperglycemia and other symptoms. Now I'm going to be talking about conventional treatment and reported CAM usage on type 1 diabetes. Conventional treatment for type 1 diabetes is insulin therapy. Insulin should be injected 1 to 4 times a day with a syringe, insulin pen, or insulin pump. There are 4 types of insulin, classified according to how quickly they begin working and how long the insulin lasts in the body. There is rapid-acting insulin, such as Humalog and Novolog, short-acting insulin, which is regular insulin, intermediate-acting insulin, and long-acting insulin, such as Lantus and Levemir. Insulin can be injected into the thigh, abdomen, or upper arms. The picture in the upper right-hand corner is a picture of an insulin pump. This pump pumps insulin into the abdomen. Carbohydrate counting is another way to help patients with diabetes keep their blood glucose levels at a normal range. This method helps patients keep track of how much carbohydrates they are eating per meal. Patients with diabetes should be eating about 45 to 60 grams of carbohydrates per meal. However, they may need to consume less depending on how well they are managing their diabetes. Some patients find it difficult to maintain normal blood glucose levels using conventional treatment. This is why about 34% of adults with diabetes use some form of CAM therapy as alternative medicine. Herbs, dietary supplements, and mind-body medicine are the most commonly used CAM therapies to treat diabetes. These treatments are used to improve glucose metabolism, glycemic control, and improve overall well-being. A common CAM therapy to treat diabetes is physical exercise. Regular exercise has shown beneficial effects on lowering blood glucose and HbA1c levels. Both aerobic and anaerobic exercises increases insulin sensitivity and glucose uptake by improving the body's response to glucose metabolism and utilization. Exercise is generally safe, however, patients with type 1 diabetes run the risk of experiencing hypoglycemia or low blood glucose levels. They need to make sure that their carbohydrate intake and insulin dosage are in line with the type of exercise that they are engaging. They must continuously monitor their blood glucose levels before, during, and after exercising. In one study, 33 children with type 1 diabetes were divided into 3 groups: the control, 60 minutes of aerobic exercise for 2 times a week, and 60 minutes of aerobic exercise 4 times a week. HbA1c and lipid profile were measured before the intervention, after 3 months, and after 6 months. Results found that no change in HbA1c levels after 3 months, but HDL cholesterol increased. After 6 months, both HbA1c and lipid profile improved significantly in those who exercise at least 2 times a week. In another study, both aerobic and anaerobic exercise improved glycemic control in 401 kids with type 1 diabetes. This shows that regular exercise has valuable physiological and health benefits for pediatric diabetes treatment and care. Another CAM therapy that has promising results is vitamin D supplementation. Studies have shown that decreased vitamin D levels in pregnancy or early childhood may be associated with the increased risk of developing type 1 diabetes. Low vitamin D status has shown negative effects on beta cell function. Vitamin D produces immunomodulatory effects, which improves glycemic control and insulin sensitivity, and may prevent the death of insulin-producing beta cells within the pancreas. Vitamin D supplementation is generally safe. Vitamin D toxicity due to megadoses may occur, but those occur very rarely. Up to 4,000 IUs per day is considered safe. In one study, patients with type 1 diabetes were given 4,000 IUs of vitamin D3 and 1,200 milligrams per day of calcium. HbA1c levels and vitamin D levels were measured at baseline and again at 12 weeks. Patients were able to lower their HbA1c levels at 12 weeks if they had high vitamin D status at 12 weeks. This shows that vitamin D supplementation has an effect on glycemic control for patients with type 1 diabetes. Another study was done on children with type 1 diabetes and vitamin D deficiency. They were given a total of 300,000 IUs of vitamin D3 and 40 milligrams per kilogram per day of calcium. Vitamin D and HbA1c was measured at baseline and again at 3 months. Results showed that vitamin D3 supplementation improves HbA1c levels in kids with type 1 diabetes and vitamin D deficiency. Magnesium supplementation also have promising results. Patients with diabetes tend to have lower magnesium levels. The lack of magnesium affects insulin secretion and increases insulin resistance in tissues. Magnesium improves insulin sensitivity and decreases the risk of cardiovascular complications associated with the disease. Blood glucose levels increase when magnesium is lost through increased urine output due to high concentrations of glucose in the kidneys. Magnesium supplements under 350 milligrams is generally considered safe. However, some medications may affect magnesium absorption. Some side effects from magnesium supplements include stomach upset, nausea, vomiting, and diarrhea. Patients with diabetes who also have kidney failure should not be taking magnesium supplements. In one study, 110 patients with type 1 diabetes were either given 300 milligrams per day of magnesium or no supplement for 5 years. HbA1c, renal function, and magnesium levels were assessed every 3 months. After 5 years, no difference was shown in HbA1c levels. Magnesium supplementation was able to restore a normal magnesium status and prevent or delay the onset of polyneuropathy compared to the control group. In another study, 147 people were divided into 3 groups: those with diabetes and foot ulcers, those with diabetes but no foot ulcers, and a healthy control group. Magnesium levels, HbA1c percentage, fasting glucose, creatinine levels, and lipid levels were measured for all groups. Patients with diabetes and foot ulcers had low magnesium levels compared to the other 2 groups. Therefore, there was a strong association between magnesium levels and incidence of diabetic foot ulcers. Magnesium levels need to be controlled with patients with diabetes with or without foot ulcers. Magnesium supplementation can be a complementary treatment in these cases. The following 4 CAMP therapies have shown some efficacy, but they do not have as much evidence as the ones previously mentioned. Cinnamon is an herb known to have anti-diabetic properties. It is able to help glucose enter cells by increasing the amount of GLUT4 receptors, and insulin receptor substrate. A study found that it was able to prevent glucose from spiking after consuming a meal. Bitter gourd or bitter melon is another botanical that has hypoglycemic effects. It is able to increase cellular glucose uptake, preserve beta cells, stimulate glycogen storage in the liver, and stimulate insulin secretions from beta cells. 2 mind-body techniques include yoga and Tai Chi. They have been shown to reduce stress and improve quality of life in patients with diabetes. A study conducted shown that patients were able to reduce their BMI and anxiety while improving general well-being. Another study found that 6 months of Tai Chi helped patients with diabetes reduce their fasting glucose, HbA1c levels, and improve quality of life and their performance of diabetic self-care activities. After reviewing the following CAMP therapies, it is recommended that patients with type 1 diabetes adhere to the conventional method of insulin therapy and carbohydrate counting as the primary method of treatment. Physical exercise, yoga, and Tai Chi are the exception because they are valued for their countless benefits for overall health and well-being. However, patients with type 1 diabetes have to be careful when participating in physical exercise due to its effect on blood glucose and may cause hypoglycemia. Vitamin D supplementation is another promising CAMP therapy that not only helps with diabetes but also with other chronic diseases such as cardiovascular disease and osteoporosis. It is readily available and inexpensive. The CAMP therapies described, physical exercise, vitamin D supplementation, and magnesium supplementation show promising results, but there is still much research needed to be done before they can be added to the list of conventional treatments. The same can be said for the other CAMP therapies receiving more attention, such as cinnamon and bitter gourd. The concerns include long-term use and side effects. Thank you for watching!